Well, hello, everyone. This is Jeanne White. Today I am the producer of this series that we're doing with, partnered up with Sheila Wilson to do a series called Wine and Cheese. And Sheila comes on, and she has different individuals that come on and speak about different situations that are happening in a hospital environment. And so today I want to welcome Sheila Wilson, and then Sheila's going to introduce her guest today.
Okay, Jeanne White, how are you?
Good, thanks.
My name is Sheila Wilson, and I'm president to Stop Healthcare Violence. And today I'm going to be talking again to Beckett Augat and Amy Smith. Now, Amy Smith, if you could take just a couple of minutes and introduce yourself. Tell us where you work in the hospital and how long you've worked there, and then we'll all get together, and Beckett, you and I will talk about what are the changes since the last time we spoke. How is it working out for you guys? Amy?
All right. Hi, Sheila. Hi, Jeanne and Beckett. My name is Amy Smith, and I'm a nurse on the South Shore. I work primarily from the emergency room department. I have been an ER nurse for 18 years, clinically in my practice for 24 years. Since this pandemic of COVID has begun, I've moved from the emergency room to a surge unit and am in the role of a CCU nurse with all COVID patients.
Wow. Well, how is that working out for you?
It was certainly
from the emergency room to CCU?
It's a much
with
different
all
environment.
Covert? Yes, I bet. So your whole manner of working as an ER nurse has changed.
It is completely
It's not
different.
even it certainly is. Amy, how are you doing?
It's working out. It's been 3 weeks. I feel like I have a handle on the routine, but the patients themselves are sick. And it's a very sad, slow process of what's happening to them physically.
Right. Beckett, how are you doing this week?
I just got off my 412, and I ended it with 8 hours as a helping hands in the ICU. And it was truly amazing to see those nurses in action. And I think they I usually work emergency room, Worcester County.
Right.
I've been doing it for 12 years as ER, 14 years in my practice, and 28 years in emergency medicine. So it's humbling to see what these nurses are doing in the ICU, from the extensions to trying to keep track of 9 different pumps on extension tubing with multiple lines, A-lines, just everything that they're doing. I watch them do a paralytic and the interventions that they need to do that to keep that patient's pulse ox elevated so they could change the intubation settings. Or the ventilator settings. It was just amazing what those ICU nurses are doing right now.
I just read something about they're turning patients over onto their stomachs so that they can breathe better.
Proning.
Yes,
and I don't know.
Proning.
And it takes like 5 people to turn somebody over?
Yes,
well, right. It's just amazing. I've been in the field for 40 years. I spent 10 years in the CCU, 17 years in an emergency room. And I don't think I've ever had to turn somebody over to breathe like that. Maybe turn them on their side, and certainly not intubated. There is so much going on that's different. But to go from the emergency room to helping hands in the ICU, and you're on a CCU, Amy, with covert patients, that is huge. I have to applaud you. I don't know if I could do that now.
It is a much
what else
different
is going on?
realm.
Have you? What were you saying, Amy? I'm sorry.
It's a much different view of a patient, for sure. I think the bonus for us, I say the bonus, in a nursing realm, being in the COVID-only ICU, it's such a case mix. We have one CCU nurse that runs the room as a rule on the overnight shift. That's when I work. There are more resources during the day. And their case mix of nurses that they're working with, so I'm from the emergency room. There are PACU nurses, endo nurses, all very much come from a different view of patients and patient care. And these CCU nurses are truly in charge of running 5 patients with a lot of hands to help. It's incredible.
But it is. But the other thing that I see that's kind of like on your plate, too, is that there's no visitors. You're responsible. And you're up there, one with the covert patients, the other one in the units, and your patients die, and they're dying alone. And you're there as a family member, maybe. You're the one that they hear your voice the last. How does that affect you?
That is the piece you allow to kind of, it seeps in when you come home for me in the morning, sitting and having my coffee, because it's the eyes. And really all they're seeing are your eyes. We've got masks on, we have goggles on, we have bouffant caps and shields and gowns and several pairs of gloves. It's missing the human compassion touch that is so necessary when you come into this world and when you go out of this world. Probably more so for those left behind, for those leaving this world, but it's huge. And it doesn't get to happen. So
but the effects that it has on you.
I'm not sure.
What do you... Beckett, how do you feel about this?
I had a rough couple past days. It was just from the ER perspective of, reminding people that if we're going to intubate, let's make a phone call out to the family and hopefully we reach them. Just in case they don't come off that tube. We had one that we couldn't reach the family, and I sat there crying because I just pictured the wife realizing that we called and then knowing that was her last chance. So those moments, they're rough, and we're just going to keep having them until this is done. And you process and you do the whole ER thing. I mean, we don't have, I don't know about you, Amy, but we just don't have time to process it right now. Because
That's right,
we wouldn't be able to do what we need to do if we sat down and just melted every time. And we can't take the time. We can't take the time to do that right now. We've got to just keep moving forward and keep the keep the eyes forward and do the care, the compassionate care, the reason why we went into nursing to begin with the individual patients in that moment, and move on from that moment. And later on down the road, we will be processing this, and it won't be pretty.
Now, normally, all of us as nurses are in the forefront, and we run towards the danger. You are now in a forefront that every time you turn around, you're running towards danger. There has to be some place that you can stop and just think. Is that ever allowed? I mean, your exhaustion has to be so strong. And so what are you doing to help yourselves? Are you doing anything to help yourselves? Nurses are well known, or healthcare workers are well known for not doing anything for themselves. But how are you managing this, or are you?
I know for me, I moved out of my home. It's for twofold. I have an asthmatic 20-year-old son. and my husband's a diabetic with high blood pressure, and he's 50. So for their safety. But it also, in a little bit of a selfish way, I moved in with a coworker of mine who also works in the emergency room. It's a little bit selfish because we come home, we both work the night shift, and we can decompress together. We can chat about the shift. We're talking about the same players because we work in the same location, so that's helpful. And I don't have to watch my family worry for me. I know that they do. We, of course, talk daily, but I don't have to see it on their face. So it's a little bit of a selfish protection for me.
Beckett?
So I was in the dorms the last time we spoke. The area offered us dorm rooms at a local college, and I have a son that has a extremely reactive airway when he gets a virus, who's 12, and I moved out because of that. I could not ever live with myself if he had gotten sick from COVID, because I would never think that he had gotten it from the community. It would have always been from me. And he's very impulsive, so he loves to hug, and he's my snuggle bug, so he could not resist coming to me every time. So, yeah, and I agree with Amy. Part of it is the selfishness, but I'm in a dorm entirely by myself, in an apartment entirely by myself, and it can be a little isolating at times. I miss my son. I miss the hugs and snuggles. But at the same time, I know he's safe, so that's one less checklist of what did I touch, what didn't I clean enough, one less stress off of me, making sure he didn't get ill from coming from work to home. So now it's, I use the term empty in the bag. My father's always said that, and he worked as an EMT firefighter for years, so that's who I decompress with. I will give him a call when I start to get overwhelmed and just let loose. And he gets it.
That's amazing. I mean, he certainly, when he was a firefighter or an EMT, he had his share of lots of opportunities that he needed to decompress. Mm-hmm. Because what they do out in the streets is just unbelievable. And go ahead.
He was funny. About 2 years ago, he pulled me aside. He's like, I want to go out for dinner, just you and me, out for dinner. And he had a moment because he got lung disease from a fire years ago, and now has a medical retirement from the department. He realized going through that he was going to need help, and he realized that, a lot of the times when they needed help, they always came to me. I'm the oldest. I'm the nurse. And it was funny because he had a moment where he realized he had a really bad call, and I made the calls. I found him the connections to decompress. I have friends working in the ER. The emergency community is very tight. We know each other. Mm-hmm. And he had a moment, I guess, where he realized that he might get a 15, 20-minute call, and then I get that patient for the next 12 hours.
Yep.
And he said, and that's where we had the conversation about empty in the bag. He says, you can only continue in this field if you recognize when your bag is becoming full and you have a way of emptying it. So he wanted to know how I emptied my bag. I have a best friend who's in the field. She's an ICU nurse. So, I had talked to him about that, but that was his main idea, is that, I want to make sure that my daughter's able to empty her bag. So I'm very blessed.
You are. I think that's absolutely amazing to really stop and think of it, because as healthcare workers, we're the last people. We're the worst patients. We run into this danger. We don't give ourselves the time or the energy, and we're there for the patients. That's our job, no matter what happens. Mm-hmm. And I know that if something hadn't happened to me, I would be there right with you guys. But I'm afraid to work and to get involved in this. And I had enough of the emotional trauma in the ER that you see these kids and they get injured and they die. And you're seeing it the whole time you're working. And it's not just the elderly. There's young people there that you're dealing with that are intubated, and they're scared. And as you say, they only see your eyes. It's tough, you girls. It is really tough. So I'm just curious. What do you think can be done to get through all of this? Any solutions? And how about the PTSD aspect of it?
I think the PTSD aspect is not going to be realized, of course, for a little bit when this is over, and the heightened awareness of the world around us has stopped, and yet we can't back down. Because right now, yes, we're heightened, but we're trained to be heightened and suppress it while the world is heightened as well. But when that all comes back down and the sleepless nights for some are still happening, or they come into work and that in-your-face camaraderie that we so need starts to die down, kind of like when the new baby comes home and everyone's coming to visit, and then that dies down. I think that's when we're going to see the onslaught of challenges for a whole generation that's very digital. But I do hope that a lot of them are realizing the human connection that is needed. And
how did you now? You work on the South Shore, but Becca, you work more in Boston area, correct?
Worcester Central, like Worcester area.
Yeah. Were you able to see the planes that flew by?
I was actually sleeping at that point because I just finished my fourth 12 in a row.
Oh, I see. Because
I was not waking up. I do overnights. Yeah, I do 7P to 7A shift.
That's. I don't know how you do it. Once I did the Baylor program, 7 to 7, and I only could sleep 3 hours a day. I don't know how you girls do the night shift. But again, it's tough. It's tough.
I'm not sure I could live in the day realm. There's a lot of people on the day shift.
I think we're similar souls, Amy.
I think so.
I bet you are. I'm just going to stay with. I still work. Well, I don't work right now, but when this is all over, I'll be back to work, but not in the ER. I would do occupational health now. But the time is running out. We have maybe 8-9 minutes left. What do you think about? Does your Sheila, yes?
You have enough time.
Okay. Thank you. What about the onslaught of suicide that's happening? The doctors and the nurses?
I don't think we've seen the end of it.
I don't think we've seen the end of it either.
We're back to the whole, it's not just the PTSD. I mean, I don't know about you, Amy, but when we were hearing what was going on in Italy, and then all of a sudden we've got it here in the United States, and you're reading and you're hearing constantly about what was going on in New York, and every day we're just anticipating the start of the start of it, the start of the surge. Oh, it'll be this week, it'll be this week, and now it's here. But those weeks of anticipating it coming, you have that pre-anxiety, they were calling it like a pre-PTSD, where you're just anxiously awaiting what's going to happen. You have an idea of what's coming, but you just don't know how bad it's going to be. And our numbers here in Worcester are continuing to climb. We've got the DCU unit set up. We've got the DCU center, which is like our hockey, our ballrooms, our exhibition is now set up as an out hospital, like just for COVID. And they've got that running with nurses from our hospitals, from other hospitals. they applied for these positions to go in there and work specifically with the population. And we've had patients shipped in from Boston, from surrounding areas to go here, just to help with the overflow and to help the hospitals just keep being able to take care of the patients as they're coming in. But I don't think that we've seen an end. We're not going to see and we've already discussed this before, but that our mental health, not just as healthcare providers, but as a whole society, is lacking. We have mental health patients that, it was very tenuous to begin with. I don't know about you, Amy, but we could have patients sitting there for 7 days, 8 days, waiting for a bed placement. And now we're going to add the strain of all these healthcare providers who are going to need psychology, psychiatrists, and there's just not enough of them. We're always trying to find a psychiatrist at our hospital. We always have open positions in that, and all the surrounding hospitals. So
right.
when this is done, and we're still having this need for the healthcare providers to be taken care of, we don't have the healthcare providers to do that.
Right. We don't. And, even when I worked in the ER, patients would come in and they'd sit there, and they were expected to sit on their stretcher for 3 to 4 days until a bed opened up.
Yep.
And how do you do that to somebody that is having a lot of feelings that, in an emergency room is not a psychiatric ward? You try your best, but you're right. Your hospitals aren't having any debriefing programs, no places that you can go and you can yell and scream and cry and hug each other?
We have a wellness program.
Any type of a program like that.
Yeah, at my hospital we have a wellness program. They've, of course, put out the initiative to contact, is it EPA? Is that the Employee Assistance Program?
Yeah,
yep, exactly.
That's not what I'm
into. Right. Well, we also have a wellness program.
So
but
what's that like?
I don't know. I've not accessed it myself. I know one of the emergency room nurses that I work with, who does a lot of meditation, holistic health, holistic dieting, and things like that, is a part of that. And she has reached out. I know in our emergency room, our manager has allowed her to do quiet, distant Reiki sessions with nurses.
Oh, cool.
During shift, if time allowed. I'm very fortunate where I work that my manager in the emergency room was a nurse in the same department, and so has worked side by side with many of these nurses. And now the younger nurses that have come in, usually their moms. So she's in tune to the well-being
needs of the department
and the needs of her department, which is wonderful. That is not house-wide. As co-chair of the union, it's sad to say, that is not what I'm hearing across the board.
Across Massachusetts, because that's not the case where I am.
Yeah.
So what can we do? What could help serve now? We have the Stop Healthcare Violence Facebook, and we have Heal the Healer. What would be important to healthcare workers? Any ideas? Any solutions that you can think of if we don't get ahead of this PTSD, we're going to have a lot of nurses. So,
because we're talking about the emotions of people, it seems like it would be common sense, but the older I get, I find that that's not that common. The love and compassion for the next person. So when a healthcare worker is saying, please stay home or wear your mask out in public, because honestly, I'm telling you that would be best practice for us to try to get a handle and be safe. And yet, how many people in society want to block that for whatever their individual reasons are?
I know.
To go with the person who's standing at the bedside saying, I understand your skepticism, But I promise you, I've stood at the bedside of a 38-year-old person that took them a half an hour to eat the Jell-O I fed them, talking to them about their family and their 3 kids, excited that he was extubated and going to get up in the chair, and he passed that next day. But he looked like he was getting better because we don't have a handle on what this virus is really doing to you.
Right.
And yet common sense doesn't tell them to just stay home or just wear the mask.
I almost feel like the society has reverted to teenage boys where it's not going to happen to me mentality.
Right.
They go, well, I'm 32, I'm healthy, I'm this, I'm that, and this is affecting everybody. And there's no rhyme or reason. I mean, yes, if you have comorbidities, obviously you're at a higher risk, but it's affecting all walks, all races, all genders, all ages.
Yep.
Nobody.
You know somebody with that comorbidity. You know somebody. If it's not you.
And how many times do comorbidities not get diagnosed right away?
Exactly.
So, I mean, I have an autoimmune disorder that it took probably close to 5 years to diagnose. So you don't know. You don't know what you have. But first of all, it doesn't matter if you're perfectly healthy. You can still get this. It's a virus. It's a virus. It's not selective.
No, it's not.
So, these kids that were doing the anti-quarantine parties and then tested positive, and they were young.
Right.
Yep.
But it's moments like that you have to go, you just shake your head and you said, and not only that, but at the same time, I know, Amy, with you and with myself, we're staying away from our families to keep them healthy. So the longer that you don't do this, the longer we're fighting this virus, this pandemic, and the longer we're staying away from ours. I haven't seen my parents in 2.5 months.
Yeah,
I see them from the end of their driveway. And that's it. I haven't been able to hug my father, hug my mother, my grandmother, anybody in 2.5 months. And I'm a hugger, so it's killing. That's rough.
Right. That's the saddest part. I have an aunt and uncle in their 80s. Their children will only talk to them through a window. I keep track of them by the phone, and their food gets delivered to them by their children, and it is one of the hardest things because that's a place that I would go and I could talk to my aunt and have a cup of tea and just kind of debrief, talk about everything. And when you can't see your family and it goes on and on, it's really tough. It's very sad, and the longer that these people don't do what they should be doing. But there's an old saying, you can't fix stupid. And you try, but I don't think they're all.
Unfortunately, we're doing a lot of sedating of it right now.
Yeah. Well,
because we end up.
You're right.
We're running out of meds too. I mean, I don't know what you're seeing, Amy, but I know that we've had to go from Nimbex to now we're to Rock because we're just running out of it. So it's not even just the PPEs, but it's the medications that we need to keep these people sedated and even paralyzed so that we can help their bodies rest.
I'm sorry, Amy?
We already use Rock and Beck in the emergency room. I didn't know what Nimbex was when upstairs.
Well, we use it in the emergency room too, but they were actually using it in the ICU where they had used Nimbex before because they've run out. Yep.
That's going to be the next. The next problem is going to be medications.
Well, we had a shortage of albuterol at the onslaught of this, and in the guys not wanting to do aerosolizing procedures as well, they were using MDIs. But it's 12 pumps on an MDI to equate to one unit dose of the inhaled equivalent. Yeah, and so...
And we were already short on the MDIs.
Correct. They were already short.
Oh, my gosh. Well, we're just about at the end of the program. How about if you each give a couple of minutes and say what you would like to see happen besides the fact that everybody stay home and do what they should do.
Wash your hands. Please, for the love of God. Wash your hands. Stop wearing the gloves out in public. Wash your hands. And don't dispose of them on the ground. Stop littering.
Right.
Put the gloves in the trash. If you're going to wear them, put them in the trash. Nothing drives me crazier than, like, even in the hospitals, they used to just take them and throw them on the floor, and that would not happen in our ER. So to see them out in the public just sitting on the ground, it's just disgusting. Clean up after yourselves. Don't spread the virus by being an idiot.
Right. And Amy?
I second all of that. And, just use common sense. And use this time, honestly. My kids are 26 and 20. And I really did. I mean, my husband and I are probably super old school. We've been together almost 30 years since I was 18. And, use this time to enjoy them. Mm-hmm. They're not busy. They're not work. They're yours. And you ideally brought them into this world. If you're someone who is allowed to stay at home, treasure that. I know it's hard because when you're home for reasons of wanting to, right, you've got something to look forward to, and no one likes to be told they have to do something.
Right. But
heed the warning and enjoy the time. Make good use of it. Because this next generation will be anxious. But if they're just loved, they won't even notice it. Right.
You're right on that.
And enjoy it because Amy and I would give anything to be at home and enjoying this downtime with our family, I'm sure.
That's right.
Right. And a lot of you nurses are going home and they aren't able to go and live with somebody else or go into a dorm room or anything else. They go home to their kids and they start homeschooling them, and they're still doing everything else. And it's tough. But I would like to say thank you to both of you. I'd like to invite you back on another series of Wine and Cheese if you're both interested.
Absolutely.
And Jeanne, are you right there?
Yeah, I'm here. Oh, you're not going to finish? Okay. All right, this is Jeanne White.
Thanks for having us, Sheila and Jeanne. We appreciate it.
Okay, now stay on.
More than that, I really appreciate all the knowledge you're providing. First of all, I want to thank the listening audience for listening to this very informative conversation. If you have any comments or suggestions, I would suggest you contact Sheila Wilson. Perhaps I'll get some information from Beckett and Amy after this is over, and I will, if they're allowing, and I'll put that on the blog that I do, and you'll be able to hear the blog and read the blog and hear the audio with it. So again, I want to thank everyone for listening. This is Jeanne White, producer and station manager at Passionate World Talk Radio. Everyone be safe, please. Thank you. Bye now.